The legalization of cannabis has taken what was once considered an illicit trade and made it increasingly a part of mainstream society. The legalization has raised new questions about how cannabis is regulated and who benefits from the new industry. Joining us for a conversation are Joe Devlin, Sacramento City's first Chief of Cannabis Policy and Enforcement, and Kimberly Cargile, CEO of A Therapeutic Alternative, a cannabis dispenser and advocate. Next on Studio Sacramento. Kimberly, what would have been the risk to you, even say 4 years ago, of coming on this show and having a discussion about cannabis?
Well, things have changed quite a lot in the last 10 years, and our entire industry is slowly coming, as they say, out of the shadows into the light. So we used to not talk about these things in public or in situations that weren't private. And, every day the conversation around cannabis is growing in this country, especially in this state, and it's an honor to be here today.
Well, it's interesting because to have someone who's active in the industry with a city official at the same time, this wouldn't have even been thought of a couple years ago. Joe, how did we get here?
It's been an incremental march, I think, towards legalization, going back to Proposition really 215 and a number of legislative moments in between that, really with the culmination of the passage of Proposition 64 and then the SB 94, which merged the recreational with the medical systems into one. And finally in 2017, we now have one comprehensive framework for managing all of cannabis.
And when people think of cannabis generally, they have their own particular either experiences or assumptions that comes with that. What is, give us kind of the ecosystem of the industry. What are its components?
Well, I think we can both agree that cannabis has certainly changed a lot over the last even 10 years. And had we gone about regulating cannabis 30, 40 years ago, it would have been a much simpler process.
Really?
Cannabis grew up. So what once was simply flower turned into oils and extracts and a whole variety of edibles and drinks. And with that, you had cultivators and manufacturers. The state has added a function for distribution as well as transportation, as well as our economy changed also. So enter delivery. And just like any other part of our economy, consumers also want their cannabis delivered as well.
Kimberly, it's interesting. There are all of these uses, and it's a much broader subject than what most people, and I'm not trying to be just funny and saying just a joint.
Yeah.
Okay. How did you come to be involved in the cannabis industry?
Well, I've been studying natural medicines, a variety of natural medicines, for about 20 years. And I was studying cellular and molecular biology in college for 5 years and working my way through college as a personal fitness
Now, was this
trainer.
out here in California?
It was in California, Humboldt State University.
Okay. Mm-hmm.
And working my way through college as a personal fitness trainer, yoga instructor, and cannabis cultivator. And so I started studying about cannabis and learning about its repression in this country, along with a variety of other holistic medicines. And spent 2 more years in college studying groups of people that have been repressed and how they've risen above that. Basically studying how stereotyping leads to generalization of a population, how negative stereotypes and generalization can lead to discrimination, which can lead to segregation, which can lead to oppression and systematic oppression. And how do we unravel all that to provide rights for people?
And how did you get from there to cannabis, then?
So I went to Humboldt State University.
And that says it all.
Yeah. And so then I graduated with a degree in liberal studies, a minor in psychology, and a focus on social justice, and moved to Sacramento 10 years ago and became a patient's rights advocate, working with local and state government to advocate for protections for patients, consumers, the environment, and the public.
Patients' rights. What form of patients' rights? I mean, advocating for people to get health care coverage, or what?
Absolutely. So in 1996, when Proposition 215 was passed by the vote of the people, when people started...
And remind us, what did that proposition do?
The Compassionate Use Act provided, it was a one-page law that provided that seriously ill Californians can obtain and use cannabis legally in the state of California. And so by using cannabis as a medicine, you gave up other rights. You gave up rights, parental rights to your children. You didn't have any protections. You gave up rights for your job, for housing, for health care, for organ transplants. And slowly over the last 10 years, we've been fighting to advance the rights for this group of people who are using this non-toxic medicine to be able to be afforded the same rights we all are, you know, anybody who uses pharmaceuticals or alcohol.
How does it feel today, based on that track record and that time doing that work, to be standing on the other side where cannabis has been brought right, not just to the edge of mainstream, but kind of has tipped over?
Yeah.
When that initiative passed last year, how did you feel? Tell us where you were at.
Well, I feel incredibly blessed to be born when I was, because there's people who have been fighting for this plant and the freedom of this plant for almost 100 years now, since 1937 when it was criminalized in this country. And so the fact that I was born when I was, I get to see the progress. You know, I've only been fighting for 10 years, and I've seen so much progress in the last 10 years, you know. We used to not tell people where we worked. We didn't have permits from the city. There was no regulations. We were really putting our lives on the line for providing this medicine to people. And now we have permits, we have state licenses, we have protections, we can talk about this freely, and there's not so much stigma attached to the idea that I am the director of a dispensary, and people are realizing that we're doing this to help people. What we've been telling them all along, they're finally starting to believe us, which feels really good.
And Joe, Kimberly's story sounds so different than what many of us would traditionally assume about who people are that are involved in this business. What's been surprising to you as you've moved into this new role in regulating and creating essentially a framework for how cannabis is going to be integrated into our city? What did you learn that surprised you? Everything.
I don't think that there hasn't been something just pretty much every day that hasn't surprised me. It is a very diverse community. I think I had a concept of the cannabis community when I started this position. I think that perspective has certainly evolved.
In what way?
You have now, for example, you have people that are really just now getting into this, and they're coming in with large amounts of capital. They are very bullish on the industry. Often they don't have much knowledge about really the history on it, or even how the industry works and how to cultivate or how to extract. They're really just the people bringing money into the system. And then you have really the people that have carried this torch for, you know, sometimes years or decades, sometimes
like Kimberly,
like Kimberly, yeah. Sometimes even multiple generations within a family working towards bringing this to the point of legalization, and that's one of, I'd say, the challenges that we're having right now is that there are people being left behind in this economy and having difficulty making the transition.
Look, you know, I'm glad you raised that. Let's talk about that for a second. What is the conversation that's going on right now about equity? Because, you know, I've heard from many that say that traditionally disenfranchised communities who were involved in the cannabis industry when it was illegal, and many of whom have members who are still in the criminal justice system, that not only have those folks been left behind, but as a matter of fact, they couldn't even participate legally in this industry because of barriers, to be frank, that municipalities like Sacramento, Los Angeles, Oakland, and others have put into place that make it very hard for people who aren't well-heeled to participate.
Well, it's a very important conversation that that has begun in I think across the state, and certainly it has begun in Sacramento. It affects really a number of people across the spectrum within the cannabis, from the person that was arrested for possession or sale of cannabis to the small farmer. The requirements for doing this legally are capital intensive. The tenant improvements necessary to build out a cultivation room are around $100, $150 a square foot. And so to get any sort of scale, you start needing large amounts of capital. And that's really necessary, not just to meet the city's requirements, but also the state and our own building code. So there's not great ways around the need for capital, but it is absolutely true that folks are not participating maybe at the rate that they should be.
So I want to bring you guys back to maybe 9-10 years ago. There was a show that came out on Showtime called Weeds, and it was about this young widowed mother who, out of desperation, went into the cannabis business. And that was really the first sort of popular culture mainstreaming of cannabis. What really kind of flipped that show and the notion and impact it had on its head was that cannabis had traditionally been thought of as sort of a end the disadvantaged areas among poor communities type of activity. And here was a middle-class mother from Orange County who was actively engaged in this business. The question I have for you, because you're sitting in the position of government, is what is it that the city of Sacramento is either doing or thinking about in answering the question as to why should people, I'm going to pick on you, Kimberly, legally be able to participate in the business, but I'm still locked up in jail for the same thing that's legal today?
Well, first, I think Kimberly did risk certainly arrest and potential jail time. Her entry into the market was before that there was a clear legal pathway for this, and so she probably, no doubt, had some encounters with the law. But in Sacramento, we've begun and had this beginnings of discussion at the council. We are getting ready to roll out the establishment of a program to help those folks that were impacted by the criminalization of cannabis, that are either in the cannabis industry or want to be in the cannabis industry, make that transition into now the legal cannabis industry. And I believe that program will ultimately be successful, and I look forward to us.
So that's a stay tuned then.
Yep.
That's a stay tuned. I actually want to know, Kimberly, did you have any close calls with law enforcement prior to the legalization?
I have.
Tell us a story about that.
Okay. Well, I was part of the movement to try to bring safe access to Sacramento County. And there was a number of dispensaries, approximately 100 dispensaries that opened in the county. And I was working very closely with them on all the private meetings, and was one of the people that opened a dispensary. So we were raided, and
Were you arrested?
I was not arrested. So I was actually teaching a class at Sac State the other day, and I was talking about the subject. We were talking about equity. And I told my story about how I was not only not arrested, but I also held up my camera and was able to lecture the police as they were raiding us and taking everything from us.
How were you able to get away with that?
Privilege. I mean, that's what I'm saying.
Say it the way it is.
Yeah, I'm saying that I was able to do it, I think, because I'm a white girl, right?
Mm-hmm.
I mean, we were talking about this in class and talking about equity and how how there's certain people that have really been able to push the industry forward based on the way they look, based on the way they talk. And I've actually had conversations with people where they ask me, like, Kimberly, you talk like them, you look like them, you need to like help us out of this, help move things forward for us. And so part of, my studies were social justice, and the reason why I'm doing this is because nobody should be arrested for a plant, nobody should be in jail for a plant. And part of being on the front lines of this industry over the last 10 years has been hard personally, after being raided, after your business is shut down, went through bankruptcy, lost my house, I've been through it all. So even if you're not arrested, there are still repercussions of coming in contact with law enforcement.
What led to you filing bankruptcy and losing your house that was related to cannabis?
Investing my life savings into starting a business that was shut down by the local government.
Wow. But you came back again. What fuels that passion in you to stick with this through going through traumas like that? Some people would just hang it up and say, forget it.
Yeah.
What is it about cannabis that draws you back again and again?
It's the patience. One night, so when I first started in this industry, I was tasked with filming interviews with patients to find out, why are they using cannabis? Is it really helping them? Do we really need dispensaries? What's this all about? And after spending a few weeks one-on-one with patients, hearing their stories, I woke up in the middle of the night and I was like, this is serious. These are legitimate patients with legitimate health concerns who are using cannabis, who it's helping them. They keep coming back because it's really helping them. And they need somebody to stand up for them, to speak for them. They're too scared because they have no rights, or they're too sick to stand up for themselves. And that's really what fuels the fire.
Joe, I want to come back to Kimberly's comments about social equity and justice. One of the things that I had heard about, I want you to comment on, was that there was consideration at some point of doing a social equity study among the communities that had been most affected by cannabis. But the city decided not to do that as a information gathering activity and to inform how it is that you all are structuring the regulations and the outreach programs. Why did the city decide not to do that?
Well, so we actually did.
Oh, you did?
We did, and so initially it was thought that we didn't need to do the study in order to move forward with our equity program. We did go back and do that study, and I think it was good that we did it for a number of reasons.
That's even better information. What did you learn from it?
Well, surprisingly, and sadly, maybe nothing, shocking. We learned that there were certain neighborhoods that had a disproportionate number of cannabis-related arrests.
Give us an example. Name a neighborhood.
North Del Paso Heights.
Okay.
Oak Park, Valley High, Meadowview were a couple of them, as well as certain demographics of persons were disproportionately arrested. African Americans make up 15% of the population in Sacramento, yet they made up 44% of the cannabis arrests in the city. So,
what do you think drives that? Or were there any conclusions as to what drove that?
I don't think we got into causation. I think there's certainly a lot that goes into why persons were disproportionately or over-policed maybe in their neighborhoods.
So you have this information now, okay? What are you all going to do with it?
So we're going to be releasing it here very shortly in conjunction with our request for proposals to start up this small business support center, and it will hopefully be it's the study that's driving the criteria or eligibility for the program, and hopefully this program will be successful in really helping persons directly impacted by it.
So the city's going to support entrepreneurship in this area through this center?
Absolutely. I think really with the goal of creating ownership and hopefully wealth creation for these people.
That's interesting. Putting on a different view, when you think about the work that you're doing in the city of Sacramento and the other municipalities within the state, Oakland, San Diego, Los Angeles, that's all happening in a climate where it is that from the federal government and from our current federal attorney general, we've heard a lot of murmurings about essentially returning to prior decades from an enforcement perspective. How does that factor into how you all are going about doing your work?
I think we're following state law. We're following the framework that has been adopted by the voters of California, and the feds. I think that there's still an unknown at this point as to what they're going to do. In California, we really do need cannabis to be descheduled. It's really going to be the only way that we get after the illicit market, illegal, unlicensed market in this state. We really need descheduled in order to really address that.
Kimberly, do those federal pronouncements make you sleep less soundly right now since they've been coming out?
No.
You're a cool customer. Why not?
Because I follow local law and state law, and really the federal government is not all bad. There's a lot of great people working for the federal government, even the DEA, who are really just trying to make the world a better place. And so if those people have anything to do with it, I would not be a target because I am in full compliance with city and state law.
Tell us a little bit about your dispensary and all of the things that it does and who it serves.
Well, A Therapeutic Alternative is located in Midtown Sacramento. We serve every demographic of person with a variety of illnesses and disorders, and most recently adult users, meaning you don't have to have a recommendation. So if you wanted to use cannabis recreationally, like as an alternative to alcohol, you could come to us to purchase if you're over the age of 21. It's really interesting though that something I found out after January 1st of this year, that 80% of those adult users are still coming to us for medical reasons. So they can't sleep, or they have pain, or they have depression or anxiety, they're trying to get off of pharmaceuticals. And so really our main focus is medical. We put a lot of time and attention into education, ongoing weekly education for our staff, and provide a variety of complementary services and programs to our patients, like yoga, massage therapy, sound therapy.
Really?
We do, yes.
It's interesting though, the range of uses for cannabis is unknown still to a lot of people. Share with us kind of, the spectrum of all of the uses that people come in for and things, different types of applications that maybe folks who aren't involved in the industry or aren't users wouldn't know.
Yeah, so that's a great question. There was a comprehensive study which looked at all the research and found that over 700 illnesses and disorders are helped by the use of cannabis. And so I asked, my staff, why are we seeing people? And I have a list that I save in my phone, but it kind of goes like this: chronic pain, depression, anxiety, things like ADD, ADHD, a variety of cancers, a variety of autoimmune disorders.
Really, with cancers, is it only pain relief, or is there any other application?
No, when you're dealing with fighting cancer, there's pain involved, there's insomnia involved, and there's depression involved. So all three of those. Also anxiety. So the reason why cannabis helps all these different illnesses and disorders and specific symptoms associated with them is because all cannabis is not created equally. There are thousands of strains, and within each strain, there's a different ratio of cannabinoids and terpenes, the active ingredients, the molecules that cause pharmacological effects on our bodies. And so it's really the cannabinoids and the terpenes that we need to focus on when we're finding a specific product to treat a specific symptom.
And Joe, just very briefly, 5 years from now, the industry is going to look different. Give us one sentence on what we can expect the industry to be that's different than today.
I think we're going to see ultimately some market consolidation. And that may be unfortunate to the kind of culture that has kind of brought the cannabis industry to this point. But I think that there's going to be a lot of push towards consolidation as more and more capital enters this industry.
And we'll leave it there. And that's our show. Thanks to our guests and thanks to you for watching Studio Sacramento. I'm Scott Syphax. See you next time right here on KVIE. All episodes of Studio Sacramento, along with other KVIE programs, are available to watch online at kvie.org.